Tonight, veterans hospitals are now back under the national level here, under fire, and some of the issues coming to light in hearings in Washington, D.C. mirror the ones 13 Action News exposed right here in Nevada.
13 Chief Investigator Darcy Spears shows us the key issues now drawing more scrutiny.
The VA clearly knows there's a problem. Just this week, the Office of Inspector General released a report, and the very first sentence highlights the VA's chronic healthcare professional shortages since at least 2015. Congress is now learning more about the problems with the VA's work culture as whistleblowers testified on Capitol Hill. The problems were nearly identical to ones we've exposed here in Las Vegas.
Things need to change. The culture there needs to change.
Yes, absolutely. The VA is a numbers company. There's no other way of looking at it.
Our investigation as recently as April detailed claims from more than a dozen current and past VA doctors and employees, people who describe a culture of fear at the Southern Nevada VA.
Morale was terrible. People were unsure whether they were going to have a job.
And it isn't an isolated problem. Whistleblower hearings before the House Committee on Veterans Affairs show just how widespread it's become. After Dr. Catherine Mitchell blew the whistle in 2014 about manipulation of patient wait lists, she received a Federal Employee of the Year award, but she considers that a hollow victory.
I've been described by the VA as a whistleblower success story and as definitive proof that the VA embraces whistleblowers. However, nothing could be further from the truth. Unfortunately, VA administrators today still continue to retaliate.
A psychologist from Maryland says she was pressured to reduce wait counts by scheduling fake appointments in imaginary clinics. She says things quickly went south after she blew the whistle.
I have experienced constant harassment, scrutiny, and frivolous investigations. Management has stripped me of authority in ways that have been humiliating. I am exhausted.
And she's also out. She says the VA fired her the day before she gave her testimony.
Physical medicine and rehabilitation.
In Southern Nevada, Dr. Brian Werner left the VA earlier this year after he says VA leadership not only failed to address problems he raised, but turned the tables and investigated him.
You're supposed to be transparent. You're supposed to have these agencies and whistleblowers and all these things you can file, but the reality is it really doesn't work like that, and people are afraid to come forward.
He and other doctors say patients can get caught in the crossfire.
And I've had patients that I've taken care of that were, for want of a better word, discriminated against because they had somebody who was advocating for them. And that's a sad situation. I hate seeing our veterans be short-shifted like this.
The dozens of current and former staffers we've spoken to say it's an ongoing problem here and the primary cause of turnover and staff shortages, which directly impacts patient care.
The Southern Nevada VA is approved for 3,160 positions. That includes 400 new positions added in just under 2 years. The VA says 517 are in various stages of hiring. 259 of those will start soon or are awaiting final clearance. That leaves 258 vacancies the VA is actively trying to fill in Las Vegas.
The VA sent a statement saying the best indicator of adequate staffing levels is not vacancies, but veteran access to care. But if the open positions are caregivers, then the access can be compromised. We have the VA's full statement, as well as links to the OIG report and the whistleblower's congressional hearing on KTNV.com. Darcy Spears, 13 Investigates.